Okay, hi everyone again, and welcome to part 2 of this discussion about managing ADHD. I am going to show my disclosures again, just for completeness. And just going to remind you where we got to in part 1. We spent a little bit of time introducing the issue. What's the issue? This very strong connection between hypermobility related syndromes and ADHD, and it's not just ADHD, by the way. Autism and anxiety are other areas that there's been quite a lot of research. We went on to look at what ADHD was and do a little bit of a deep dive into potential causes or theories around causes. And my message there was that through some of the physical health problems that cluster together with ADHD, we can get some clues as potentially as to the cause, or what we call the pathogenesis, the mechanism of how the ADHD symptoms are being treated. And the two important areas have emerged from this particular patient cohort as part of the super syndrome, which includes hypermobility conditions, EDS, and hypermobility spectrum disorder. Secondly, dysautonomia. And thirdly, mast cell activation syndrome, with a very important role, often a later stage role, of autoimmunity and gastrointestinal dysfunction, dysmotility. And that underpinning these three or four syndromes, or not underpinning, but shared between all of them, are these neuropsychiatric symptoms, which we understand to be ADHD in many cases, and maybe there's an explanation in this super syndrome that's important for us to look at. I'm now moving the focus away from this area and going to look at ADHD more generally and how we think about management of ADHD, and just share a few ideas as I take you through this, hopefully in a logical and clear way. So these are three main areas that we think about in terms of ADHD management. As a clinician working in this area, medication is at the top for a reason. And the reason is that the studies have shown that medication is really effective in many people, and it's clearly more effective than anything else when it comes to ADHD, which gives us an indication of just how biological ADHD is. The medication influences neurotransmitters, particularly dopamine and noradrenaline, and we're going to look at that in a little bit more detail in a moment. Then you've got psychological intervention, formal psychological intervention. I'm going to unpick that just a little bit. And then this category, which is a sort of lump all in terms of the other stuff, broadly speaking, lifestyle optimization or modification. And I'm thinking about sleep, diet, exercise, etc. And then other interventions, developments of strategies, and we're going to look at that as well in a bit of detail. But let's talk about medication just for a little moment. I'm not going to spend ages talking about this. It's not really where I want to put the emphasis today. It is important. You obviously need a clinician, a psychiatrist, or a specialist in ADHD and prescribing of ADHD medication to guide it, because the medications need to be used appropriately. And when they are prescribed appropriately and used correctly, then they can be extremely effective at reducing ADHD symptoms. And they really do seem to work very well in a lot of people. There are two categories of medications we use in ADHD. There's the stimulants and the non-stimulants. I'm going to just briefly mention each. The stimulants are on-off medications. So you take a tablet or a capsule, half an hour, 45 minutes, 1 hour later, the effect kicks in. It continues for a period, and different preparations will last for different durations. And then it comes off, and everybody who takes a stimulant becomes untreated in the evening hours. as the medications worn off. And that's really important to allow this nighttime washout, which prevents tolerance developing and means that people can continue to take the same dose of medication with the same effects. The effects doesn't generally wear off much over time in most people, because it's stopping tolerance developing. As to which preparation, there's two different drugs of stimulants. There's methylphenidate and dexamphetamine, and then they have all the sort of different preparations of each of those, some long, some short. Anyway, that's a bit about stimulants. Non-stimulants, much more like antidepressants. You often have to take a non-stimulant for a few weeks before the effect starts showing properly. Some people respond quite quickly. It can be really useful, really useful. The benefit is they're not on off, so they build up and have more of a 24-hour effect. There's obviously, each of them have their own tolerability issues, and the short answer is that the efficacy, the effect strength is not as high as with stimulants. So stimulants are most certainly considered first line and the best choices, but certainly some people, non-stimulants are great. Now, I see medication really as providing a foundation to build on. It is not the panacea that some people portray it as. As they say, pills don't build skills. You need to often unlearn some bad patterns. What people do with ADHD is they go through life, particularly if they don't get diagnosed in childhood, and they develop a number of practices, strategies to manage symptoms. Some of those are really positive and what we call adaptive, and others are maladaptive, perhaps using substances to self-medicate in an unstable way, or getting into conflict because there's a knowledge inside that whenever I get stressed, I feel calm. These sorts of things are not necessarily good strategies, and it's about unlearning some of that stuff and bringing in other strategies. So medication creates the foundation for that to happen. However, and it does work. The studies are quite compelling in that regard, and I'm not going to go into them now, but there's lots of data in this area. And not only medication reduces symptoms and impairments, but when you look at the long-term risks and bad outcomes that happen in ADHD, there's loads of data supporting how medication dramatically modifies it. Okay, so we have to remember that, one study a little while ago said that 50% of people either don't want to take medication or can't take it, can't find one that they tolerate or benefit from. And some of the reasons for that are side effects and some other disadvantages. And some people have these psychological conflicts. Is it, who am I? Am I the true I treated self or my untreated self? They might think that it's taking my creativity away. That's not my experience with the majority of people, by the way. Medication allows people to actually properly express their creativity usually. The idea of not being reliant on something, but often many people move away from medication and come back in. And some people are quite clear that they need to be on medication long term because their life is just so much more stable and regulated. Some of the side effects of stimulants, and I'm actually showing you these because not because I think this is a central focus, but there are some downsides of medication. But interestingly, one of the side effects of stimulants and some non-stimulants actually is increased blood pressure. And I've thought for a while that these medications that are increasing blood pressure a little bit, not a huge amount, but are indirectly treating to a degree dysautonomia. And I certainly have seen a number of people with dysautonomia who are being treated for their ADHD, feeling the benefits from the ADHD medication in terms of their autonomic functioning. It's a complicated area, but worth mentioning that perhaps through one of the side effects of the medications we use for ADHD, we're actually improving other things. Brief journey through medication. The next brief section is psychological input, and this is more formal psychological input. What do I mean by that? Well, psychological input can either be group-based or individual-based or family-based or couple-based. And there's various different forms of psychological intervention used in ADHD that has some degree of evidence base. CBT is most certainly probably the most evidence-based areas. Coaching, coaching is absolutely suited to ADHD, really. The coach will sort of walk with people through things and much more empowering. But it's quite it's unregulated, especially in the UK, and therefore a bit controversial, although the model is clearly a good model. Dialectical behavioral therapy, or DBT, used initially with emotionally unstable or borderline personality disorder, a group-based therapy with a heavy slant on mindfulness and emotional regulation. They've found that it's also useful for ADHD for obvious reasons. Mindfulness, there's been some initial reasonably promising studies about mindfulness. The initial excitement was slightly modified by a new look at the studies that perhaps sort of slightly criticize some of the study design. And there's neurofeedback, which is brain training, a form of brain training, a form of biofeedback using screens and imagery to strengthen certain parts of the brain. And there is a little bit of evidence, but it's you have to do a lot of it to make the changes. And again, it's not compelling anywhere near like medication is, unfortunately, so far. But we're still looking, and there's other novel approaches that are developing. So, and then you have more specialist input when it looks at relationships or family dynamics, or perhaps thinking about vocation and what would be the right direction to take, which is a whole great and important discussion in itself. You know, what career path to take when you have ADHD, because you got to get it right. It's important to wake up every day and be very excited about what you're doing, rather than trudging through the day. Psychological interventions, the issue is that the studies that have compared medication and psychotherapy are not really showing an independent, strong signal for psychotherapy. However, there seems to be a trend towards the idea that the combination of the two, in fact, data to support that, is more effective than medication alone, which makes sense, and that the real role for psychological interventions may be where ADHD symptoms have persisted after medication, and it's sort of more focused, targeted work in that way. And again, I mentioned about coaching. So moving on to that third area of management, we're talking about the psychosocial interventions and lifestyle modification. And you can see the two sets of images I've got there. I've emphasized diet, rest, and exercise. And on the right side of your screen, I've got a picture of a daily planner, which has two sections. One is more like a calendar, hour by hour or block by block, and then a task list, really emphasizing those two areas, which are really important. I'll mention in a moment. Now, I thought about how am I going to capture some of these important messages, or these areas within this category of lifestyle modification and psychosocial intervention. How am I going to capture it? And I thought probably the best way is to introduce you to the group program that I set up a few years ago in the NHS. It's called the Life Skills Program. It's for adult ADHD. It's with the NHS Trust that I work in, the ADHD clinic in Barnet. And I set up this program and wrote this program from scratch a few years ago, and it's been molding and shaping ever since. And we're really, really excited about it. It's a project that I have got support from the trainee mental health workers in the team, and Shannon Cutting continues to support me on this project. And we're on our ninth cohort now we're recruiting for, and it's great. It's a 13-week program, and this is just a couple of comments that we've got feedback along the way, because we're using the feedback very much to develop the program and continually mold it. And really, I think when you pay attention to the areas that we cover in the program, which I'm going to show you, you can see important transformation, because we've really selected out the things that are important. And the reason I've included this little paragraph at the bottom is just to emphasize the point that being around other people who have the same issue as you or the same challenges as you, as this group is, this group of 10 to 12 adults who meet every week for 2.5 hours and really share personal stuff as well as learn stuff. They get connected, and it's very validating to see people who have the same struggles as you, and you start to realize that you're not alone, it's not your fault, and help each other change and support each other and accept each other and accept yourselves. So really important stuff. This is the program. I'm going to take you through week 1 through to week 13, I think it is. And I wasn't originally going to put in this welcome and framing session, but I thought I'd just mention it briefly because this is about the connection, getting to know each other, but also making the space safe and making sure that there is alignment of all the participants about the values of the group and some rules or guidelines around communication and respect and all the things that the group decides are important. And that really brings everyone together. We then, on week 2, do a deep dive into ADHD. ADHD is often thought of as a list of symptoms in the criteria, clustering into attention, hyperactivity, and impulsivity. It's actually a whole lot more than that, and it's a complex disorder. Hopefully I've given that, communicated that today, but fundamentally, if someone was to say to me, in a sentence, what do you think ADHD really is in terms of how to describe it, I would describe it as a disorder of regulation. The frontal part of the brain is like the conductor or the regulator of the brain, of the rest of the brain. It importantly inhibits or slows down or calms down responses. I suppose it's what makes us more human, getting a bigger and bigger frontal lobe, where we're able to stop, evaluate, weigh up past experience through our memories, and slow down and put the brakes on. And that's one of the main areas in ADHD that's not working great. So there's this disorder of regulation, and we're talking about regulation of attention. So it's not really only attention deficit. It's really thinking about regulation, where attention, either you can't stop focusing, but you're hyper focused, and the problem is putting away and closing down, as well as on the other side of the spectrum, not being able to concentrate or focus in or have sustained attention on something. And that regulation extends from attention to emotion. So emotional dysregulation is central to ADHD, regulation of activity, and both sides really hyperactive on one side and other people who are shut down and unmotivated, and regulation of impulse, stopping oneself from saying stuff or doing stuff or buying stuff. We've talked enough about medication. I'm not going to labor that anymore. We have 3 sessions on organization, really stressing how organizing your life, and I'll break it down into those 3 sections, is so important in ADHD because it's like scaffolding for you to function. When people experience a sense of internal chaos or disorder, it really helps to bring order from the outside, or from systems that you implement in your life. And the system of this session on time and task management is so central. How you manage or think about time, how you block your time out, how you keep track of what you need to do, and also how you manage tasks. Tasks come in from all sorts of places, and there needs to be a system. Otherwise, it's just chaos. And everyone will have different approaches to it, and we share some of those different ideas. And you can find loads of stuff online about this sort of stuff. We look at relationships and communication. Relationships in ADHD are often strained because of the symptoms and the impairment and the inconsistency and the lack of regulation. There's so many reasons why relationships get impacted, but we're talking about lots of different types of relationships: intimate relationships with spouses or partners, family relationships, often with other family members also having ADHD, parent-children relationships, friendships, and colleagues, and importantly, not to forget, relationship with self. People with ADHD who have often people who have not been treated during childhood have picked up a lot of baggage along the way, quite a lot of trauma, and very often self-esteem, and the way that one looks at oneself and confidence is quite eroded. So it's a really important area to look at. And in terms of relationships with others, one of the main areas that you can impact and you can produce change is thinking about communication and some basic skills or tools or rules around communication. Please excuse me. And we share some of these ideas. Again, you can look for things around averting conflict, promoting harmony in a group or in a situation with another. So that's really important. And as is this session, this is one of my favorite sessions, it's so centrally important to ADHD. About 95% of adults with ADHD will have emotional dysregulation or mood instability. Their mood changes quite dramatically, not to the extent of bipolar, but certainly quite dramatically, both in many different directions: excitement, feeling low, feeling anxious, feeling restless, but lots of changes. And it's so important to think about it. How does one regulate emotions? Well, there's a whole load of stuff you can do. So you can do things like breathing, or tapping is an amazing way of regulating and calming the system. Tapping on the body, there's an approach called emotional freedom techniques, which I absolutely love. It's certainly extremely grounding and it's great for processing trauma. Moving helps regulate rhythm and balance and coordination, and all of these things that we can do to help regulate our emotions and actually tune up our autonomic nervous system. Stephen Porges spoke earlier in the prior to my talk, and talked about neural training or neural exercises, and many of the things that we talk about in this section on emotional regulation are about that. The idea of using strategies and external aids to create more of a framework around you. And it's so important that I'm in the process of creating from scratch a diploma program for therapists to learn how to better regulate, how to teach their clients and patients how to better regulate their emotions, but in more sophisticated ways than just take a few deep breaths, which is, by the way, the best, probably the best way that you're going to regulate the emotions for many reasons. The next session is the second session on organization, and this really looks at managing information. So information is constantly coming into us in many different forms, whether it's books we're reading or on the internet or in social media, in a lecture, on a phone conversation, through emails and texts and posts. And you can just see how it can get so overwhelming with someone who doesn't have any systems in place for managing the flow of information. And I think what we try and do is help people develop some basic systems, just to help sort of stabilize that part, freeing up time and energy to thrive, really. So the next and last organization session is actually focused on stuff, your things, belongings, their entry point into your life. So buying, or more importantly, trying not to buy too much or too impulsively. And then how to think about your space and how to store your things in it so that they don't so they get used, but they don't clutter. And that whole process of decluttering and organizing central areas in your home, the bedroom and your clothes, your workspaces, and your kitchen space are three really important areas to really think about how you can make things more simple, and labeling and things like that really important and underestimated. Visual things are really important. So post-it notes and big whiteboards are very useful in ADHD. I'm not going to go into any detail now, but ADHD can obviously impact people's working lives for some of the reasons we've mentioned, and also their education. And the law is set up really to support people. ADHD is recognized as a disability within the Equality Act. Educational institutions and workplaces have a duty to work with an individual who has a disability to make accommodations. It's known as reasonable adjustments, so little tweaks to the way that they study or they work, which will help mitigate against some of their impairments and bring them in par with someone who's not disabled. And there's loads online about that. Again, self-care. I mean, we could just do the whole lecture on this one box, on this one slide. I'm so convinced that nutrition is really important in ADHD and in mental health in general for so many reasons, particularly gut health, the microbiome, that I actually trained as a nutritionist, not to work as a nutritionist, just to inform me and educate me a bit better. It's really important. And I'm going to leave you to go and discover that. But the evidence has come up that omega-3 is mild to moderately effective in reasonably high doses in ADHD. The EPA in the studies, that's one of the constituents of omega-3, was around 1,000 milligrams. That's something to be aiming for. A lot of the preparations don't have that much in. Some evidence to show that multivitamin and minerals can impact symptoms in ADHD, but it needs to be replicated. But broadly speaking, a healthy, balanced Mediterranean diet is generally coming out as important. Lots of good proteins and good fat, healthy fats. Lots of vegetables, particularly colourful and leafy green vegetables, and attention to the pattern of eating, not rushing, and eating mindfully, and listening to your inner messages as to when you're full, the interoceptive qualities, and really changing a relationship with food. And in this particular group, there are some subtleties here, and obviously for good reason. Histamine is often a big issue, as is gluten intolerance and lactose or dairy intolerance. And the reason for this is that gut health is often poor, and if your gut the lining isn't protecting you, and you're not absorbing the right stuff, or you're not breaking down things properly, or you're not providing the right protection, then invariably you're going to get things that shouldn't be absorbed, and they'll cause problems. And in many ways, when you strengthen up the gut and pay attention there to what you put into it, and you allow it to rest, intermittent fasting, for example, there's great evidence coming up for that, is really important. And exercise, again, there's evidence to support exercise benefits in ADHD, aerobic exercise in particular. And it's also, we know it intuitively. We do some exercise and we feel our mood is lifted and our focus is better. It's a no-brainer, really, and encourage you to that. And then we think about how people look after their physical health. And that's attending to other stuff, taking medication regularly, and just, keeping on top of their physical health needs as they get older and go through life with the various challenges that those life stages bring. Last two areas, this one's on addictive behaviors. There's a powerful relationship, strong relationship between ADHD and addiction. It's linked to the reward system, the dopamine dysfunction. And what you find is that people with ADHD often have an under-aroused reward system. So their normal things don't give someone with ADHD as much pleasure sometimes, and therefore there's this seeking out of things that are going to boost dopamine. and make people feel okay. And that unfortunately leads people to migrate into substance use and alcohol, gambling, and use of the phone and the internet and social media and gaming excessively without that control. And whatever the root is, all getting so absorbed into work that it becomes an addiction in its own right. And whatever the mechanism it's playing out in, it's often very much linked to the same or overlapping deficits of ADHD. And my experience is that ADHD medication can really help people to overcome their addictions, or at least manage them better. But at a certain point, when someone's tipped into addiction, they really need to see it as an issue in its own right and get the necessary support, recognizing that it can completely destroy and damage people's lives. And it makes getting control of one's life very, very difficult. And I make the point that it includes not just those substance-related things you put into your body, but it also includes process addictions, pornography, gambling, etc., gaming, etc. And these things are really becoming problematic, particularly in ADHD group, and need attention. And there's a session on finances. Again, financial management can really destabilize one's life. Financial mismanagement, and there's some basic rules about how to manage money are important. So, what am I bringing things to a close? Hopefully, that's given you an idea of over quite a sustained period of time of putting this program together and shaping it, molding it. Those are the areas that we cover. Obviously, we go into much more detail in all of them, but it might give you a bit of signposting of where to focus your attention. So I'm going to just bring things to a close, and I've tried to capture in this slide what I think are 7 key central top tips for optimal management of ADHD. The first is to embrace and understand, and that is to embrace and understand your ADHD, yourself, and your past, your history, in the context of your ADHD, which may have been undiagnosed, and try to learn to accept what you need to accept, change what you can change, and most importantly of all, forgive yourself and not blame yourself for your very legitimate and real difficulties and differences in terms of the brain function. To identify and nurture strengths. This is undoubtedly the take-home message. If you, in my experience, if someone wants to be successful in life with their ADHD, it does help if they've got support around them and intelligence. But to really work out what it is that makes you tick, that gets you excited, that you're passionate about, that you could jump out of bed for, and try and set your life up around those strengths and set your career up and how you spend your time informed by those strengths. And underpinning it is this the need to foster this lifelong focus on self-care. The reality is no one stays on track the whole time. People with ADHD often come off track. And when you are continually looking at yourself and your life in a growth focused way, where you take care of yourself and you sleep well and you eat well and you exercise and you respect your body and your mind, then you're going to have much more chance of staying on track for longer. Developing strategies, whether you're taking medication or not taking medication, you'll find that there will be some residual symptoms in ADHD. Even the person who's managing their ADHD optimally in the whole world is going to have some residual symptoms. Hopefully, a large chunk of it is neutralized, but there will always be some leftover bits. And then you have to really work out what you need to do to work around that. Do you need to cut that out of your job description? Do you need to delegate that to someone else? Do you need to open up about your difficulty in that area and get some some support. Then this idea of modifying your environment, we can to a degree change what goes on in here, but it's much easier to change what goes on out there, and what's in our views, what comes into our senses, whether we listen to music or not, or whether we the air we breathe and the how much stuff we have around us. We can decide on this thing, and you might find that clearing the clutter and making the environment more green and nature focused is very helpful. So think about your senses and what can be changed. And then again, this is so important. I don't know if people have come across it. I think many people will have come across this concept of growth mindset as opposed to a fixed mindset. It's rooted in the work of Carol Dweck, who is a psychologist in the US, who's written a book called Mindset and has various talks on TED Talks and I think other YouTube talks about this concept. It's a really, really useful idea. It basically says that you can either go through life thinking in a fixed mindset way, where you're trying to race to the top and in a more paranoid, beat yourself up if you're not the best, see everything that happens as an attack on you or a major problem. Or you can look at life as this series of learning where you're growing, and in order to learn you have to make mistakes and bring everyone else along with you, and really learn from adversity and grow from it. And so important for being healthy, particularly with ADHD. And then finally, you're going to know when you need outside help or support. And there are going to be important transition points in life with someone with ADHD. Important, going to university is a vulnerable period. Getting into a long-term relationship and settling down, having children, retiring, menopause. These are really important transitions that impact ADHD heavily, and with employment running all the way through it. And I think to access support early, sometimes in advance, before a problem develops, and to try and pull your team together, really. And I think you guys in the world of hypermobility really understand that, I think, more than many. Okay, well, thank you. It's been a bit of a journey through. I hope I've held your attention, and that some of the stuff that I talked about today gives you some avenues and some ideas about how you can take better control of your ADHD using this multimodal approach. So I'm going to thank you, and let's say goodbye.